Actually, it will because, Dr. Mensah previously talked about the immune system. You just
Mhm,
brushed on it. And so what I'd
mhm.
like to do is to have you talk a little bit more about, are there tools that you can do to assess and or enhance one's immune system when being treated for prostate cancer, for instance, or any other oncologic disease?
Absolutely. One thing basic test that we can use to look at our immune function is RCBC. What are white blood cells? And simply put, the white blood cells are the soldiers that are contracted or employed by our immune system. So they help us fight bacterial infections. They may help us fight viruses. They might help us fight our mold, our food sensitivities. And we can look at that and see, okay, based on your labs, this is what I'm seeing is deficient in our immune function. Other things that we can do, like I said, is assessing our microbiome. So I do a lot of functional testing. So we can test like actually what's happening inside of our gut and our intestinal tract to see if our bodies are actually breaking down the foods, breaking down and absorbing the nutrients properly. Because that's super, super important in our health, and also it's super, super important in giving the energy and nutrients to our immune system.
Yeah, so good bowel function then would be what, Dr. Mensah?
So good bowel function would be bowel movements that are well formed, easy to pass. So things that you want to look at, is my stool any funny colors other than our browns? Also, other than my spinach, corn, blueberries, do I have undigested foods in my stool? Does my stool sink or float? Those are really good ways to indicate on just how our microbiome and our gut function is.
Also, gas and bloating, wouldn't you say, is
Mhm.
a good indicator, whether you feel bloated after you eat and whether you have mood changes after you eat, like you feel sluggish, slow, lack of
Right.
concentration after eating.
Mhm.